Tonight, important information for people who quit smoking cigarettes. Experts say you're going to see some health benefits within minutes, but other damage does take longer to reverse. Here to talk about this is Dr. Anasuya Gunturi. Did I get that right?
You got it right.
Okay, terrific. The Chief of Oncology at Lowell General Hospital. We really appreciate you joining us. Thank you, Doctor.
Thanks for your time. So let's start with some of those early benefits. I mean, what's on the list? Go through the list because I'm sure people are curious.
Yeah, this has been studied for a long time, and there's a lot of evidence that you can see benefits within minutes. In fact, the heart rate, blood pressure, these things come down. And within hours, you start noticing that the levels of carbon monoxide in the bloodstream start to decrease. And then once you get into a little bit more, a few more days and weeks into it, you'll start seeing tangible difference in the lung function. The shortness of breath, cough, and the inflammation that the lungs are exposed to with the constant smoking slowly starts to reverse as well.
Doctor, does quitting also lower the risk of developing lung cancer?
Absolutely. Absolutely. In fact, we encourage patients who are current smokers or those who have quit within the last 15 years to get a low-dose CAT scan once a year to look for any early stages of lung cancer that might come up, just like similar to how a woman might get a mammogram once a year. But if the person has quit more than 15 years ago, then the thinking is that the risk of lung cancer is low enough that they don't necessarily need this CAT scan every year. So definitely we believe that stopping smoking and sticking to it every year, you're decreasing that risk for lung cancer. Not just lung cancer, but actually there are many other cancers that decrease, including bladder cancer and head and neck cancer and others. So absolutely.
Yeah, I'm sorry, doctor. So does that mean that, for example, some damage is permanent, or can it be reversed? I'm curious about that because they're saying if you stop right now, you can begin to see the signs of improvement.
Yeah, no, there's definitely marked improvement, but the risk of lung cancer never goes back to complete normal that somebody who's never been a smoker would be at. But having said that, it's still, absolutely beneficial, and you'll get, pretty close to that level.
Important discussion, Dr. Gunturi. Thank you so much for joining us. We appreciate it.
Thank you, doctor.
Of course, thank you.